Now, with the approval of Nigeria's health sector COVID-19 pandemic response action plan by the National Council on Health, Nigeria's Minister of State for Health, Dr. Olorunnimbe Mamora, joined my colleague CNBC Africa's Kenneth Igbomo earlier to discuss the next steps to implement the plans as Nigeria tweaks its efforts to contain the COVID-19 outbreak. Take a look.
Essentially, the objectives are there in terms of, what we really set out to achieve, and then we just follow what we have set out for ourselves in terms of working together to ensure that the response activities to COVID-19 are well coordinated and, of course, in tandem with the Presidential Task Force goals as well. So we want to be sure that the various bodies, various organizations that are working to manage this COVID-19, they are not working at cross purposes. We want to be sure that there is proper collaboration, proper harmonization of activities. So we will just we already have certain working in place, but we would now move towards integrating all these action plans that are already in place at the various levels, at the national, at the state, and even at the local government and the community levels.
Still on part of the approvals from the National Council on Health was also the community support centers. And I would like to understand how this is also going to work, because I understand that you're starting with some hard-hit states first.
You know, as it is now, we have moved into community transmission. And so that's one. And as a fallout from that reality, it becomes extremely difficult to even do active contact tracing. Secondly, it becomes quite difficult to want to isolate the hospitals, the community, the isolation centers, and of course, even the treatment centers can no longer contain the number of cases. So it is in that circumstance that we are looking at this community support center. And of course, as the name suggests, it's going to be at the level of the community in the local government. And of course, the structures of the primary health centers will just be on hand to be absorbed into these programs. And there will be the community health care, health workers who will serve as agents to really fish out cases for testing, identify, test, trace, and treat. And in putting in place this treatment center, we will use the facilities on ground, maybe schools, maybe community centers, maybe even the primary health centers available. So something that is close to the people and will be convenient for them. The important thing is that we'll be able to give them what they require, by way of a treatment. And of course, it's cases that are severe that will then be passed on to the higher or bigger centers where further management can be put in place. But if it's just a question of proper observation and follow-up, this can be done at these community support centers.
I would like to also understand the nature of your work with the private sector, because I understand that the private sector is also coming on board to build some primary health centers as well. I'd like to know how you're going to work together with them to harmonize all of these efforts so we can get better health outcomes in Nigeria.
You will recall that I did say earlier on that part of the National Health Sector COVID-19 Pandemic Response Action Plan is to ensure collaboration, optimal collaboration, and harmonization. So, and in that regard, we have been reaching out to the private sector, and whether as individuals or groups or as companies or just name it, they've been reaching out. Even the private practitioners, private health sector providers. It could even be the the laboratories as well. So we are reaching out to all this so that we can strengthen the partnership between us, because government at the end of the day do not have all it takes to single-handedly handle the issues. So it is within this understanding that we are reaching out for their partnership, for their collaboration, so that we can have this health system, the harmonization in place. And of course, the response we've been getting from them has been quite encouraging and very, very. We are very happy to report that the collaboration has been very, very good. You know that some of these private organizations, they have even been very much involved in setting up patient centers. They have been very much involved in infrastructural development in the various states, in various even at the national level. We have isolation and treatment centers set up by these private organizations. They have also been helping in the area of capacity building. They have been able to support in terms of laboratory services, which they have provided. They have been able to support even in terms of provision of medical consumables, particularly PPEs, that is private, personal protective equipment as well, ranging from face masks to face shields to boots to headwear to body, wear to boots. And not just finish. They have been gloves and all that. So they have been very, very supportive in ensuring the provision of these PPEs for supplies to the various health care institutions. So we've been having very, very good partnership with the private sector.
All right, but we've been seeing a global spike in coronavirus cases around the world, and even also evident in Nigeria. We saw on Saturday was one of the highest figures on daily figures with 779 cases recorded in Nigeria. And in trying to understand what the next steps are going to be for Nigeria, I'd like to know with regards to reopening of the places of worship as well as resumption of airlines, what measures we're going to be looking at to ensure that we have a watertight situation in Nigeria where we don't spread this outbreak further.
Yes. Recent as yesterday, the members of the PTF, the Presidential Task Force, we were taking through what was called dry run test, which was put in place by the aviation sector. And essentially what we did was to fly from Abuja to Lagos, that is from the administrative headquarters of the country, which is Abuja, to the commercial nerve center of the country, which is Lagos. And the whole essence was to see what measures that have been put in place as we move towards lifting the ban on domestic flights. So, and what we saw yesterday was quite, was quite encouraging. We were satisfied with the arrangements put in place. These arrangements were starting from even pre-boarding here in Abuja, where all the pharmaceutical intervention measures that have been put in place, ranging from temperature checks to washing of the hands, and then use of sanitizers, of course, use of face masks, and plus or minus face shield for those who want to have that.
Dr. Olorunnimbe Mamora is Nigeria's Minister of State for Health.